Hello and welcome back to our channel. In this video, we'll be discussing vaginal bleeding during pregnancy. Is vaginal bleeding normal in early pregnancy? Vaginal bleeding during pregnancy can be a cause for concern, and it's important to seek medical attention right away if you experience any bleeding or spotting. While some women may experience light bleeding or spotting during early pregnancy and have a successful pregnancy, it's still important to have any bleeding checked out by a healthcare provider to rule out any potential complications. Please like and subscribe to our channel and click bell icon to get more health updates. Reasons for light bleeding in early pregnancy. Implantation bleeding. This occurs when the fertilized egg implants in the uterus, and can cause light spotting or bleeding that occurs around the time of your expected period. Cervical irritation. During pregnancy, the cervix is more sensitive and may bleed or spot after intercourse or a pelvic exam. Hormonal changes. Hormonal changes during early pregnancy can cause light spotting or bleeding. Miscarriage. Unfortunately, sometimes light bleeding or spotting in early pregnancy can be a sign of a miscarriage. Ectopic pregnancy. In rare cases, light bleeding or spotting in early pregnancy can be a sign of an ectopic pregnancy, which occurs when the fertilized egg implants outside the uterus. What to do if you have early pregnancy bleeding? If you experience bleeding or spotting during early pregnancy, it's important to contact your healthcare provider right away. They can provide guidance on what to do next based on the severity of the bleeding and any other symptoms you may be experiencing. Rest and avoid strenuous activity. Your healthcare provider may advise you to avoid exercise or other strenuous activities until the bleeding has stopped and the cause has been determined. Avoid sex. Your healthcare provider may also advise you to avoid sexual intercourse until the bleeding has stopped and the cause has been determined. Monitor the bleeding. Keep track of the amount and frequency of the bleeding, as well as any other symptoms you may be experiencing, such as cramping or abdominal pain. Stay hydrated. Drinking plenty of fluids can help prevent dehydration, which can occur if you are experiencing heavy bleeding. Attend all scheduled prenatal appointments. Your healthcare provider will want to monitor your pregnancy closely if you experience bleeding or spotting during early pregnancy. Tests that evaluate early pregnancy bleeding. Ultrasound. An ultrasound uses sound waves to create images of the inside of the body. During early pregnancy, an ultrasound can help your healthcare provider determine the location of the pregnancy and evaluate the cause of any bleeding. Blood tests. Your healthcare provider may order blood tests to check your hormone levels and to see if you are Rh negative, which could require additional treatment. Pelvic exam. During a pelvic exam, your healthcare provider will examine your reproductive organs to check for any signs of infection, injury, or other abnormalities. Speculum exam. A speculum exam allows your healthcare provider to examine your cervix for any signs of bleeding, infection, or other abnormalities. Hysteroscopy. In rare cases, your healthcare provider may recommend a hysteroscopy, which involves inserting a small camera into the uterus to evaluate any abnormalities or causes of bleeding. The specific tests recommended will depend on the severity and cause of the bleeding, as well as any other symptoms you may be experiencing. Have you ever experienced vaginal bleeding during pregnancy? If so, what was the cause and how did you handle it? Did you find this video helpful in understanding vaginal bleeding during pregnancy? Is there anything else you would like to know? Do you have any tips or advice for other pregnant women who may experience vaginal bleeding? Please do drop your feedback in comments section. Thank you for watching and we hope you found this information helpful.